Hello and welcome back to Yashoda Hospital's online segment, the Health Talk session. The incidence of knee arthritis among Indian population is 15 times higher than the Western world. Surprised? Yes, that's the fact. So what are the causes of knee pain? And what should one do if one is suffering with knee pain? And when should one consider surgery? I'm Dr. Lakshmi, and let's discuss about recent advancements of knee surgery in our today's episode. Joining us today, we have with us Dr. Sunil Dachapalli, consultant orthopedician from Yashoda Hospitals, Somajiguda. Welcome, doctor.
Thank you.
So, doctor, knee pain or knee arthritis is become so common, especially among the younger population also. So, what are the causes for this? I mean, we all know that osteoarthritis is the most common cause which we see in the old age group especially. But what is the cause that the younger age group is suffering with knee pain?
Well, as you rightly said, knee arthritis has become so common in India. And interestingly, what we have observed is compared to Western population, Indian population are suffering mainly from the knee arthritis. The reason being the morphology of our body. Now that's number one. The number two is like knee arthritis. Apart from that, we also have other causes which is attributing, that's called secondary arthritis. Now some people would have had some injury as a child or a juvenile, or when they're in the teenage, left it unattended to, or probably it was not properly treated. So leading to irregularity in the joint surface. So because of that, there is continuous wear and they'll end up with arthritis in the future. And the most important thing now, what we are observing is obesity. So because of that, more weight is being taken over the knees and gradually the wear out. So these are all the main causes of the knee arthritis for us.
So you mean to say one will be suffering with knee pain at some time or the other in their lifetime?
Absolutely. Not only one, it'll be you and me as well. I mean, the reason being our longevity has increased. If you see, if grandparents or forefathers, at the most in those days, in independence days, if you see, the maximum longevity was 50, 60 years. But now 50 and 60 is considered as middle age. We see majority are going up to 80, 90. So as the quality of life is increasing, but the human body remains the same. So we are aging slowly. The only thing is, if at all you take care of yourself, the speed of aging and speed of arthritis can be controlled.
So the term minimally invasive surgery has become such a fashionable word. So is it a good idea, or tell us more about this?
That's a nice one, because when I was a student, I was told that big surgeons make big cuts. Like when you operate, the big surgeon will dashingly cut off very big and then do the surgery. Now we say the other way, big surgeons make smaller cuts. That's because the precision, and you know exactly what you're doing, so you don't have to unnecessarily make big surgery cuts, because you can avoid pain. The bigger the cut, patient will have more pain, more bleeding, and more time to recover from this problem. So now we follow what is called minimally invasive. So we make exactly the size of the wound that is required, and we also have special instruments for that will allow us to do the surgery within that smaller incision.
So talking about minimally invasive surgery, what are the recent advancements as far as knee replacements are concerned?
The first one is the material with which it is made. We used to have chromium cobalt, and later on we moved over to other materials like zirconium. And now we also have what is called gold knee. There is nothing but titanium oxide. So it's an alloy of titanium. Now, because of the amount of joint replacement that are happening, we have factories. So we have robotically manufactured implants with more precision, more smoothness. So the material has improved. And also in between the metals we have a plastic. Earlier day it used to be Teflon, which failed. Then later on we moved to plastic. Now we have ultra-molecular plastic. So with this, the wear rate, see, we keep on talking about, a lot of people are worried if we have joint replacement in 10 years it's going to be failure. The failure is nothing but one of these plastics become worn out slowly, and then it becomes loose, so we have to change it. So if at all we have a plastic which wears slowly, the longevity of the implant increases, and that's what we have currently. Now the next thing is, like we discussed, the minimally invasive. What we do is we make smaller cuts, patients have less pain. That will allow us to make the patient walk on the same day within 4 hours. And next is the pain team. It's not only the surgeon which is important, it's also the pain team that is taking care of the patient. We assess the patient regularly, make sure they don't have much pain. And now if you see, we have more advancements like robotics. Now we have seen AI, artificial intelligence, in most of the things. Similarly, we are getting robotics, and we are blessed now with the knee surgeries being done with the assistance of robot. Now, most important thing you should understand is robotics doesn't mean that the robot will walk in and do the surgery. It's like an arm, robotic arm. At the end of the day, it's done by the surgeon, and it is assisted by the robot. The reason for this is the precision. It improves a lot so that the failure rate is decreased.
So doctor, we've discussed about minimally invasive surgery. What exactly do we mean by that? So what should be the realistic expectation of the patient after the surgery? I mean, does your knees feel the same? I'm sure it wouldn't.
Now, our human intelligence is such that you forget the past very soon. Now, people would have been there, very active. Later on with the arthritis, gradually they progress, and then they are unable to walk, even go to the washroom. You have surgery, and suddenly you realize in a day or two, you are able to go to the washroom on your own. That gives immense happiness, immense pleasure. Now, gradually over time, people forget their past, that they couldn't walk to the washroom. Now they feel, yeah, I'm doing everything okay. Now I'm being restricted because I can't do 10-kilometer walk or something like that. So it's all the matter of perception. But I can say it's a lifestyle changing operation. The reason being, we have seen a lot of people suffering inside. They don't want to tell outside because they're worried if at all they express, they'll have to undergo surgery. I have a lot of people coming back to me and said, oh, I should have done this before. I wish I should have taken this decision before, because now I'm so free and happy, I can do most of the things. I wasted my time. See, you postpone your surgery by say 5 years, 10 years. 10 years I operate, and you get almost near normal life. And then you realize, I wasted all my time. So that's why, if at all you're suffering with pain, then you should have this operation.
So doctor, do you think the outcome for all the patients is pretty much the same, or are there any risk factors that you consider before taking the patient up for a surgery?
That's a very nice question. Thanks for asking that. The reason being, people are worried. See, the common notion is, now your neighbor will say, by the way, you're walking so well now, or you're walking reasonably, and after having surgery, you might not be able to walk, or you'll be bedridden. So please don't do the surgery. What you should understand is, any procedure will have a failure rate. Okay, but we have to see the success rate. Now with the knee replacement, the success rate is almost like 95-96%. When we say success, that after the surgery you should be able to perform most of your activities without much pain. The reason for failure is multifactorial. It starts off with the surgeon. Now if you have an experienced driver to your car, there won't be much accidents. But if you have an inexperienced one, he'll be like all over. Similarly, I would suggest choose a surgeon who has a long track record. So that is one. The next thing is choosing the appropriate implants, which has a track record again. How long have they been in the market? What is the failure rate? The important thing later is the patient factors. So what I suggest is, from the patient side, you should do regular exercises. You should have a healthier lifestyle so that the prosthesis, the implants that are being put, do not fail. Remember, it's not for lifetime. It all depends on you.
So it's basically like you're in charge of your knees for the rest of your life after surgery.
Absolutely.
So it's time to take few questions, or it's time to bust few myths what we have across. So the first one is, knee replacement is only for 50 years and above.
Yeah, I agree with that. It is mainly for elderly population. Even 50, like we said, it's a middle-aged one. I would personally consider knee replacement is a choice for above 60. But the thing is, it all depends again on the lifestyle. If there is a valid reason to change your joints, I don't mind changing even if you're 26 or 25. The youngest I've changed was 14. So individualize for each patient.
Moving to the next one. Excessive walking is not good for the knees. Myth or a fact?
It's a myth. Everybody should walk, irrespective of whether your joints are completely worn out. See, the reason for walking is not only you're putting your weight on the bones, there are lots of things that are active around the joint, your muscles. If you give work to the muscle, they strengthen up. So they decrease the load on the joint. And with walking, you get lubrication that brings in some nutrients into the joint, so the surfaces become better, and also improved blood supply. You lose weight. So instead of carrying 2 people on the joint, you're carrying only 1 person. As you lose weight, the pressure decreases, pain is less. So my suggestion, please walk.
One cannot bend their knees completely after surgery. Myth or a fact?
It's a myth again. I would suggest go with how much ever knee bending you have. The reason why we go for what is called high flex implants that will able to you to sit down on the floor is, in our Indian circumstances, there were scenarios people have to sit down or squat down on the floor. But it all depends on your knee morphology, because if before operation, if you have very good movements, post operation you have full movements.
The replaced knees will not last more than 10 years. Myth or a fact?
It's a myth again. Like I said, it all depends on the surgeon, implant type and the patient factors. And we all, as surgeons, we have registries, joint registries. The most popular is Swedish Joint Registry, where each and every step is recorded. So we check that records, and usually it's about 20-25 years.
So doctor, before ending this episode, what is that final advice you would like to give to everyone out there?
Thank you. The main thing is be active. Like I said, please walk. That's the best exercise. You don't have to plan your gym time and you lose that. You don't have time for yourself. At least walk for some time, at least 2 kilometers a day. And that's one. And have a healthy lifestyle. Doesn't mean that you don't have to go for all this junk food. Go for that. But have a disciplined life. Don't put on too much weight. And the next thing is, if at all there is a problem, consult immediately. Don't keep on postponing, saying, I don't have time. We should find time for ourselves. You have to take care of your body. Nobody else is going to do for you. We don't want things to get worse. So please be aware and take care of yourself.
It was wonderful having you here, doctor.
Thank you very much.
So this brings us to the end of this episode. We've been discussing about recent advancements in knee surgeries with Dr. Sunil Dachapalli. Hope you all enjoyed watching us, and do join us for the next week as well. Thank you and take care.